talk about now general recovery for some of these different injuries. First of all, how important is it, doctor, to take the time to fully recover before coming back to play? A lot of people don't do that. They're like, I'm ready, and you're saying, no, you're not.
It's incredibly important. It's incredibly important down here in Florida. Florida is one of the states where you actually have year-round baseball, right? You can play any season. So for a long time, athletes in the U.S. were three-sport athletes, but over the course of the past, I don't know, 15 years, more and more people are becoming one-sport athletes. So they lose that chance to rest. You know, if you're playing baseball all the time and throwing all the time, it's different than if you actually take time off to play football, or if you take time off to play basketball or soccer or lacrosse, whatever else have you. And
how do you have that discussion, let's say, with those parents that want their, little future baseball MLB player to get back in there, and you're saying, I wouldn't do it?
Well, that's a great question too. I mean, for me, in some ways, it's easier, because a lot of times if they come to see me, they're seeing me in clinic because there's a problem. And once you have a problem, as long as it's a small problem, it can be a little warning flag for you, and then it's a chance for me to say, hey, maybe it's time to take a step back.
And what is the protocol, if you will, that would work somebody? Of course, it depends on the injury, of course, but what do they do with their trainer and physical therapist to kind of ease into that process?
The treatment of these kind of injuries is there's almost a generic kind of cookbook for it, but basically what you're doing is you take the appropriate amount of time of rest. That can be a week, it can be 6 weeks if you're having something else that's a little more serious, and then gradually getting back into sport. And it depends on the muscle group that you're talking about.
And what about over-the-counter medications?
I think over-the-counter medications can be helpful. I mean, anti-inflammatories are a great way to decrease the amount of inflammation that the person's having, and a lot of times that's the goal. Whether or not you treat it with rehab or you treat it with some medication or a combination of the two, that's what you're trying to do.